When a person reaches the age of 60, the body begins to function in a way that is noticeably different from earlier decades of life. Muscles are not as strong as they once were, joints may become stiff, the cardiovascular system does not perform at peak capacity, and recovery after any kind of exertion is slower. This means that even everyday activities such as walking long distances or lifting moderately heavy objects can cause strain. When it comes to intimate activities like masturbation, the same principle applies, but often people do not give it the same careful thought. Overexertion during masturbation after 60 can be dangerous because it combines physical effort, increased heart rate, hormonal stimulation, and sometimes psychological pressure. All of these elements, if not managed wisely, can put a serious strain on the body, particularly on the cardiovascular system. The heart is already working harder to pump blood through arteries that may be stiffer due to age. Sexual arousal raises blood pressure and quickens the pulse, which can become risky if a senior pushes too far, ignores signals of discomfort, or extends the activity longer than the body can handle. One of the main reasons overexertion is dangerous is the link between sexual activity and sudden cardiac events. Doctors have reported that for older adults with underlying heart problems, sexual excitement can trigger chest pain, arrhythmias, or in severe cases even heart attacks. While masturbation may seem less intense than intercourse, it still involves rapid breathing, elevated heart rate, and muscle contraction, all of which can mimic a workout. If someone does not pace themselves, the sudden demand placed on the heart could be overwhelming. It becomes even more dangerous if an individual has a history of hypertension, clogged arteries, or past heart conditions. Seniors who do not recognize this risk might treat masturbation as a youthful act, ignoring the reality that their body has changed. Beyond the heart, overexertion also takes a toll on muscles, joints, and nerves. At 60 and beyond, many people experience arthritis, reduced flexibility, or neuropathy. A prolonged or awkward position during masturbation may strain the back, shoulders, or hands, leading to stiffness and pain afterward. Since recovery is slower with age, even a small strain can linger for days, reducing mobility and causing discomfort in daily life. Seniors may not immediately connect joint pain or muscle soreness to sexual activity, but the relationship is real. An older body requires gentler movements and shorter durations to avoid unnecessary stress. Another factor that magnifies the danger of overexertion is the decline in testosterone and estrogen levels with age. Lower hormone levels mean the body is slower to recover energy after orgasm. While in younger years, repeated or intense sessions may not cause lasting harm, after 60 such behavior can leave a person feeling drained, lightheaded, or fatigued for hours or even days. Overdoing it not only weakens the body but can also affect mood, leading to irritability, sadness, or anxiety. Mental health is closely tied to physical well-being, and ignoring these warning signs can create a cycle of overexertion followed by guilt and fatigue. Furthermore, some seniors use medications that interact negatively with sexual strain. Drugs for high blood pressure, cholesterol, diabetes, or depression can affect circulation and stamina. When a person exerts themselves too much during masturbation, the side effects of these drugs, such as dizziness, low blood pressure, or irregular heartbeat, become more pronounced. A simple activity that should provide relaxation and stress relief can suddenly turn into a health scare. That is why doctors warn that moderation and awareness are essential, especially for those on regular medication. Overexertion also increases the risk of injury to delicate tissues. The skin becomes thinner and less elastic with age, making it more vulnerable to friction and micro tears. If a senior continues beyond the body's comfortable limit, small injuries can occur, leading to irritation, swelling, or even infections. The urinary tract and prostate are particularly sensitive areas in older men, while postmenopausal women often experience dryness, which makes overexertion even more harmful. These physical realities highlight the importance of respecting the body's signals instead of trying to match old habits from youth. Another subtle but serious effect of overexertion is sleep disruption. While orgasm often brings relaxation, pushing the body too far may result in restlessness, difficulty sleeping, or waking up feeling unusually tired. Seniors already struggle with sleep patterns due to hormonal changes and health conditions, and exhausting the body through excessive effort worsens the problem. Good quality sleep is critical for immune strength, memory, and mood stability at older ages, so any activity that disturbs it must be controlled. In addition, overexertion can cause psychological stress. Many seniors still feel pressure to perform as they did in their younger years, and when their body shows signs of weakness, they may ignore it in order to prove their stamina. This mindset is dangerous because it encourages pushing past safe limits. Instead of enjoying a healthy, private activity, the individual ends up battling frustration and disappointment. The mental toll of feeling weaker than before can lead to decreased self-esteem, which may discourage them from practicing intimacy altogether. That creates loneliness and emotional distance, worsening overall health. A more balanced approach is to treat masturbation after 60 as a form of self-care rather than performance. Light, moderate engagement allows blood flow to improve, releases stress-reducing hormones, and maintains a sense of vitality without exhausting the body. Seniors must remember that quality matters more than quantity or intensity. Listening to one's breathing, monitoring the heartbeat, and paying attention to muscle fatigue are key practices to avoid overexertion. Some may even benefit from consulting their doctor to ensure their sexual activity is safe given their medical conditions. As people age beyond 60, the body becomes more sensitive to existing medical conditions, and any physical activity, including masturbation, needs to be approached with awareness and caution. Many seniors carry a history of health issues such as high blood pressure, diabetes, prostate enlargement, arthritis, or cardiovascular disease. These conditions can silently influence how the body responds to sexual arousal, and ignoring them while engaging in masturbation can turn a natural and healthy act into something risky. Doctors emphasize that after 60, the priority is not to pretend that the body is the same as it was in youth but to adapt intimacy and self-pleasure in ways that respect current health limitations. When someone overlooks their medical condition, they may unintentionally push their body into unsafe territory, which can result in short-term discomfort or long-term complications. One of the most significant risks comes from cardiovascular disease, which is very common in older adults. Sexual arousal naturally raises the heart rate and blood pressure. For a person with a history of hypertension, irregular heartbeat, or clogged arteries, this sudden increase in strain can trigger serious events like angina or even a heart attack. If a senior ignores their heart condition and treats masturbation as though they were still in their 40s, the danger becomes real. Even if a crisis does not occur immediately, the repeated stress can weaken the cardiovascular system further, leading to worsening of the condition over time. Doctors often advise patients with known heart issues to monitor how their body reacts to sexual activity and to stop immediately if they feel chest discomfort, dizziness, or unusual shortness of breath. Another health issue that cannot be ignored is diabetes. Diabetes affects nerve sensitivity, blood circulation, and healing ability. Seniors with diabetes who masturbate aggressively or without caution may cause small skin injuries, which in a younger person might heal quickly, but in a diabetic individual could become infected and take weeks to resolve. Poor circulation in diabetic men can also affect erectile function, and pushing the body too hard to compensate can cause frustration and added stress on the vascular system. For women with diabetes, dryness and fragile tissue in the genital area can make masturbation uncomfortable, and ignoring this problem by continuing without lubrication can lead to micro-tears, infections, and pain that reduces overall quality of life. Recognizing these risks and adapting behavior, such as using gentle techniques or safe lubricants, becomes essential. Prostate health is another critical area for older men. Enlarged prostate, also known as benign prostatic hyperplasia (BPH), is extremely common after 60. This condition makes urination difficult and increases the risk of urinary tract infections. Masturbation can sometimes relieve pressure in the prostate, but if ignored medical issues are present, overstimulation may worsen irritation or cause discomfort. In men with a history of prostate cancer or surgery, the risks are even higher. Ignoring medical advice in such cases may not only delay healing but can also complicate long-term health. It is important for men to be aware of their prostate condition and consult their doctor about what level of sexual activity is safe. For women, menopause brings its own set of medical concerns that must not be ignored. Lower estrogen levels cause thinning of vaginal tissues, loss of elasticity, and dryness, which increase the chances of pain or injury during masturbation if proper care is not taken. Women with osteoporosis, another condition common after menopause, need to be cautious about positions that strain the hips or back. Those who ignore these realities might experience pain, injuries, or infections that could easily have been avoided with a more thoughtful approach. Ignoring medication effects is another hidden danger. Seniors often take multiple prescriptions for chronic conditions such as blood pressure, cholesterol, depression, or anxiety. Many of these drugs affect sexual function, either by reducing libido, limiting erection strength, or causing dryness. Pushing the body to perform without acknowledging these medication effects can lead to frustration, self-blame, and unnecessary strain. For example, men who take blood pressure medications may already struggle with erectile dysfunction, and forcing prolonged stimulation may cause anxiety and fatigue without satisfactory results. Women on antidepressants often experience reduced sensitivity, and if they ignore this side effect, they might keep going longer than is safe, resulting in soreness and disappointment. Another aspect of ignoring medical conditions is neglecting mental health. Seniors who have a history of depression, anxiety, or loneliness may use masturbation as a way to cope. While self-pleasure can indeed reduce stress and release feel-good hormones, ignoring the underlying mental health condition and relying too heavily on masturbation for relief may cause emotional imbalance. Instead of being a source of relaxation, it can become a compulsion that leaves the person feeling drained, ashamed, or even more isolated. Recognizing the role of mental health in sexual well-being is just as important as acknowledging physical conditions. The urinary system is also highly sensitive in seniors. Many older adults struggle with urinary tract infections, incontinence, or weak bladder control. Masturbation without considering these conditions may worsen irritation or lead to bacterial spread if hygiene is not prioritized. Ignoring such problems can result in painful infections, frequent urination, or burning sensations, which are much harder for seniors to recover from than younger adults. Doctors often stress the importance of hydration, cleanliness, and gentle care when engaging in sexual activity at this stage of life. What makes ignoring medical conditions particularly harmful is that seniors sometimes feel embarrassed to discuss sexual health with their doctors. They may believe that masturbation is a private matter and therefore do not disclose how often they engage in it or what difficulties they face. This silence means they miss out on medical guidance that could make the activity safer and more enjoyable. Some seniors even avoid checkups altogether because they think sexuality is irrelevant at their age, when in reality it remains an important part of overall well-being. By ignoring conversations about their conditions in relation to sexual activity, they leave themselves vulnerable to preventable harm. Adapting masturbation to medical conditions does not mean giving it up. Rather, it means respecting the body's needs. A senior with heart disease might choose shorter sessions with rest breaks. A diabetic individual might use safe lubrication and be extra cautious about skin care. A person with arthritis may select comfortable positions that reduce strain. Someone on medication that affects libido might accept a slower pace and redefine pleasure in a way that matches their current state. These adaptations allow seniors to enjoy intimacy while protecting themselves from the risks that come with ignoring medical realities. In the end, the key message is that masturbation can remain safe and beneficial after 60 only if medical conditions are taken seriously. Ignoring them not only risks physical injury or illness but also damages confidence, mental health, and overall quality of life. Seniors who listen to their bodies, acknowledge their medical challenges, and adapt their practices accordingly can continue to enjoy self-pleasure as a natural part of aging without fear of harm. Awareness, honesty, and balance are what transform masturbation from a potential health hazard into a supportive, life-affirming activity in later years. When people cross the age of 60, their skin, muscles, and immune system are not as resilient as they once were, which means that the body reacts differently to physical stimulation. This makes the use of unsafe methods or poor hygiene during masturbation especially dangerous. At younger ages, the body can often tolerate minor mistakes, such as rough handling, use of unverified products, or skipping proper cleaning, without serious consequences. But in senior years, the risks are multiplied because the skin is thinner, recovery is slower, and infections spread more easily. What may seem like a harmless shortcut or experiment can actually create lasting harm. Doctors repeatedly emphasize that safety and cleanliness are non-negotiable when it comes to self-pleasure in older adults. One of the most common mistakes is using unsafe objects or methods for stimulation. Curiosity or boredom sometimes leads people to use everyday household items instead of safe, medically approved products. The problem is that such objects are often not designed for the body. They may have rough edges, toxic materials, or shapes that cause internal injuries. For men, inserting foreign objects into the urethra or using hard, non-sterile items for stimulation can lead to cuts, bleeding, or urinary tract infections. For women, inserting unclean or unsafe objects can damage delicate tissues, leading to irritation, infection, or even internal injury. At 60 and beyond, the tissues are far less forgiving than in younger years, so a mistake that once caused mild discomfort can now result in a painful, long-lasting medical problem that requires treatment. Another danger is the use of unverified creams, oils, or chemical products to enhance pleasure. Seniors often encounter advertisements for quick fixes that promise stronger erections, longer stamina, or increased sensitivity. Tempting as they may seem, these products can be unsafe, especially when bought without medical guidance. Many contain harmful chemicals that can irritate the skin, disrupt hormone balance, or interact dangerously with medications that seniors are already taking for blood pressure, diabetes, or cholesterol. Applying such substances without knowing their ingredients can lead to allergic reactions, rashes, or severe infections. Some oils and lotions that are fine for external skin are not meant for sensitive genital tissue and can cause burns or persistent irritation. This problem becomes worse in older adults, whose skin barrier is weaker and whose immune systems are less capable of fighting off complications. Poor hygiene practices are equally hazardous. A major risk comes from not washing hands before or after masturbation. Bacteria or dirt from the hands can easily transfer to the genital area, especially since older skin often has tiny cracks that are not visible but provide entry points for germs. For men, this can mean balanitis or inflammation of the foreskin and glands, while for women it can result in yeast infections or urinary tract infections. Seniors are particularly vulnerable to urinary tract problems because bladder control weakens with age and infections spread more easily. Once a UTI develops, it can quickly escalate into kidney issues or sepsis in elderly patients if left untreated. What could have been avoided by simple handwashing instead becomes a serious health complication. Another overlooked hygiene mistake is failing to clean sex toys properly. Seniors who use vibrators or other devices sometimes forget that these items need careful cleaning after each use. Bacteria thrive on surfaces, especially in warm, moist environments. If a toy is used repeatedly without thorough cleaning, it can introduce harmful germs into the body. In older women, who often experience vaginal dryness due to lower estrogen levels, the tissues are more fragile, which means infections can spread faster and healing takes longer. For older men, improper cleaning of devices can lead to prostatitis or recurrent urinary issues. Using safe, Body-friendly materials and following proper cleaning instructions is vital, but many ignore these guidelines due to embarrassment, lack of awareness, or a mistaken belief that age makes them immune to such problems. Neglecting lubrication is another form of unsafe practice. As people age, natural lubrication decreases, especially for women after menopause. Men may also experience less smooth arousal due to changes in hormone levels and circulation. Attempting masturbation without lubrication in these cases can lead to friction burns, skin tears, and micro-injuries. While these injuries may seem minor, they open the door to bacterial or fungal infections. Ignoring this basic precaution creates unnecessary suffering, when the solution is as simple as using a safe, water-based lubricant designed for sensitive areas. Unfortunately, some seniors instead turn to petroleum jelly or other household substances, which are not suitable for genital tissue and can trap bacteria, causing infections. Beyond physical harm, unsafe methods and poor hygiene can also have psychological effects. If a senior injures themselves or develops an infection, the resulting pain and shame may discourage them from engaging in intimacy again. This withdrawal can lead to loneliness, reduced confidence, and even depression. Since sexuality is still an important part of emotional health after 60, creating conditions that make the experience safe and positive is crucial. When people neglect hygiene or experiment recklessly, they risk losing an important source of comfort and self-expression. Immune decline with age magnifies every risk. The body does not fight infections as effectively, which means that what would have been a small problem in youth can become a major issue in senior years. For example, a minor cut from unsafe stimulation might heal quickly in a young adult, but in a 60-year-old with diabetes or vascular issues, that same injury could take weeks to recover, all the while exposing them to bacterial invasion. The cost of ignoring safety grows larger with age, and seniors often underestimate just how fragile their health has become. There is also the issue of balance and mobility. Seniors with arthritis, osteoporosis, or weak muscles may attempt unsafe positions or movements that strain the back, hips, or hands. This can cause sprains or falls, especially if they are in an unstable posture. While this might seem less obvious compared to infection risks, physical accidents from unsafe methods are very real. A strained wrist or back pain may not only cause discomfort but also interfere with daily activities. The solution lies in adopting safe, hygienic, and gentle practices. This means choosing sex toys that are made from body-safe materials, cleaning them thoroughly after each use, avoiding unverified creams or chemicals, using proper lubrication, and washing hands and genitals before and after the activity. It also means respecting the body's limits by avoiding overly vigorous techniques and choosing comfortable, stable positions. These small but consistent precautions transform masturbation into a safe and beneficial experience rather than a source of risk. In the end, ignoring hygiene and safety may provide temporary pleasure but risks long-term harm. Unsafe methods or unclean practices can lead to infections, injuries, pain, and loss of confidence. Seniors already face enough health challenges without adding preventable complications. By prioritizing cleanliness, safety, and awareness, older adults can ensure that masturbation remains a healthy, satisfying, and restorative activity. Rather than treating it carelessly or with secrecy, embracing safe practices allows them to enjoy intimacy with peace of mind and without fear of negative consequences. As people grow older, especially after 60, the body's rhythm changes significantly, and energy is no longer limitless as it once felt in younger years. At this age, balance becomes the key to every aspect of life: diet, exercise, sleep, and even sexual health. When it comes to masturbation, excessive frequency can disturb this balance and create a chain of problems that affect physical strength, hormonal stability, emotional well-being, and overall vitality. While masturbation itself is not harmful and can be a healthy part of life at any age, overindulgence after 60 can weaken the body, drain energy, and disrupt the delicate equilibrium seniors need to maintain in order to stay healthy and active. One of the first effects of excessive masturbation is fatigue. The body of a 60-year-old is not able to recover as quickly as that of a 30-year-old. Each orgasm requires energy, increases the heart rate, raises blood pressure, and stimulates the nervous system. In moderation, this can feel refreshing and even improve circulation, but when repeated too often, it leaves the body feeling drained rather than energized. Seniors may notice that after frequent sessions they feel weak, lightheaded, or unusually tired the next day. Unlike youth, where energy rebounds quickly, older adults take longer to recover. This ongoing depletion can interfere with daily tasks, reduce motivation, and make them more vulnerable to other health problems. Another issue that arises from excessive frequency is hormonal imbalance. Orgasms trigger the release of dopamine, oxytocin, and prolactin, hormones that regulate mood and satisfaction. In moderation, these hormones create feelings of relaxation and happiness. But when overstimulated, the body's natural balance can become disrupted, leading to mood swings, irritability, or even a sense of emptiness afterward. Seniors already experience shifts in hormones such as testosterone in men and estrogen in women, and their systems are more fragile to sudden changes. Overindulgence can exaggerate these natural declines, leading to reduced libido over time, erectile difficulties, or decreased sensitivity. What was once an enjoyable act can ironically become less satisfying because the body no longer responds in a healthy way. Excessive masturbation also affects sleep patterns. For some, an orgasm can bring relaxation and aid in sleep, but for others, especially when done repeatedly or too close to bedtime, it can overstimulate the nervous system. Instead of calming the body, it may cause restlessness or shallow sleep. Seniors already tend to struggle with insomnia or irregular sleep cycles, and disturbing this fragile rhythm can reduce the quality of rest even further. Poor sleep not only leaves one tired but also weakens memory, concentration, and immune strength. In older adults, these effects can show quickly, making them more prone to accidents, forgetfulness, or illness. Physically, too much masturbation can also cause wear and tear on sensitive tissues. At 60 and beyond, the skin is thinner, more fragile, and less elastic. Without sufficient time to recover, the genitals can become sore, irritated, or prone to micro-injuries. In men, frequent masturbation can irritate the prostate or lead to temporary erectile fatigue, making natural arousal more difficult. In women, excessive stimulation without enough lubrication can cause dryness, swelling, or even small tears that increase the risk of infection. Seniors with diabetes or weaker immune systems are particularly vulnerable because their bodies take longer to heal from even small irritations. Another concern is the impact on mental health. Excessive frequency can become compulsive, where masturbation is used not only for pleasure but also to cope with loneliness, stress, or boredom. While occasional use for stress relief is natural, relying on it too much can create dependency. Seniors who feel emotionally isolated may turn to masturbation as a substitute for intimacy, but overdoing it can actually increase feelings of emptiness or guilt. Instead of providing comfort, it becomes a cycle of temporary relief followed by fatigue and dissatisfaction. This can reduce overall confidence and even discourage them from seeking real social or emotional connections, deepening isolation. Excessive masturbation can also strain the cardiovascular system. Each orgasm involves a temporary spike in blood pressure and pulse rate. For someone with heart disease, hypertension, or clogged arteries, frequent repetition puts unnecessary stress on the heart. Over time, this may increase the risk of heart complications. While 1 or 2 times a week may be safe for most healthy seniors, doing it daily or multiple times in a single day can turn into an invisible stress factor. Since the body at 60 has less cardiovascular resilience, ignoring this risk is dangerous. From another perspective, excessive frequency can lead to reduced satisfaction over time. The brain gets used to high levels of stimulation and begins to require more effort or intensity to achieve the same level of pleasure. This desensitization can make ordinary arousal less effective, leading to frustration. Seniors may then feel that their body is failing them, when in reality it is simply overstimulated. This frustration can damage self-esteem and reduce overall enjoyment of intimacy, whether alone or with a partner. For men, too much masturbation can contribute to issues like delayed ejaculation or erectile dysfunction, where the body struggles to respond normally during partnered intimacy. For women, it can cause increased sensitivity issues, where the genital area feels sore or less responsive. Both outcomes make natural intimacy harder, which can further isolate seniors from meaningful connections and create a vicious cycle of dependence on masturbation alone. The immune system also suffers when the body is constantly drained of energy. Excessive activity can lower resistance to infections by overtaxing the nervous system and reducing rest and recovery. Seniors already have weaker immunity due to age, and this imbalance can leave them more vulnerable to colds, urinary infections, or other illnesses. The energy spent excessively on sexual release could otherwise be supporting vital body functions like healing, digestion, and cognitive strength. Moderation, on the other hand, offers many benefits. Masturbation in controlled frequency can improve mood, keep circulation active, and maintain a sense of youthfulness. It becomes harmful only when frequency exceeds the body's capacity to recover. For seniors, this often means limiting activity to a few times per week, or whatever feels energizing rather than exhausting. The key is to listen to the body. If fatigue, irritability, or physical discomfort follow the act, it is a clear sign of overindulgence. Unlike youth, where pushing limits may feel harmless, seniors must prioritize balance over intensity. In addition, finding healthier alternatives for emotional needs can reduce over-reliance on masturbation. Seniors who engage in light exercise, meditation, hobbies, or social connections often find that their urge for excessive self-pleasure decreases naturally. When the mind and body are occupied with fulfilling activities, masturbation becomes a healthy addition to life rather than a compulsive escape. The goal is not to eliminate it but to fit it into a lifestyle that supports energy, health, and joy.